of the workforce and the challenging nature of the system that workforce will be working in. Okay, so I'd now like to introduce Dylan Roberts, who's Chief Digital and Information Officer here at Leeds in the City Council. Dylan has been here doing some critical work and leading critical work, particularly around the Yorkshire and Humber Local Health and Care Record Exemplar, which I hope he'll tell us a little bit about. But that's been a concept that has kind of illustrated the criticality of the digital future that we will all be working in. And he's also chair of National CIO Council, working with government on behalf of all localities to try to shape and develop digital policy and strategy. And has been placed in the top 5 of the CIO 100 for the last 3 years. So thank you very much, Dylan.
Thank you. I think it just proves the power of technology, how some of the photos of the speakers today have been photoshopped there to make us look so brilliant, actually. So there you go. So yeah, I think I'm conscious of the fact that a lot of what I was going to talk about would have echoed a lot of what Trudy and David talked about. And I think what I will do instead is sort of talk about the direction that we're taking in Leeds, but have it in mind that in order for us to deliver that future direction, we need digitally savvy leaders. And digitally savvy leaders isn't people like me, technologists, because I've come from a technical background and I'm looking to apply that to make changes across the health and care system. That skill needs to come from people who've got expertise in the vertical they're working in. So in particular, in this case, healthcare. And as well as having that healthcare skill, really important, in my opinion, that you've got skills in terms of how digital can change things. And when we talk about the digital approach in Leeds, the digital approach in Leeds is not about how technology can automate the existing processes, although we're doing some great things around integrated care records and things like that, which are delivering some efficiencies. But it's also about, now that we're in the digital age, how can we potentially change our system altogether to affect better outcomes for people. And there are different, so not only have we got the opportunity because we're in the digital age, we all know that the current system, you could say, is broken. So the challenges facing the NHS are significant. Some of those have already been raised today. And the pressure is such, and the demand is such, that we have to flip the model and think differently. And I think digital provides the opportunity for us to do that. So the strategy in Leeds, and this is the digital strategy, although you might say where we really need to get to is have the health and care strategy with digital at the core, not a digital strategy sort of telling the health system how they should change. But our digital strategy in Leeds is we take a place-based approach. So this strategy has not just been developed from the council or the CCG, it's been developed across the system as a whole. And that's looking at how we can apply a combination of information resources from across the system, hospital, CCG, council, and combine that with the latest digital technologies, and hopefully combine that with human endeavour. Human endeavour might be in this room, could be academics, it could be citizens, entrepreneurs, to deliver better solutions for Bob there in the middle, and better outcomes for Bob. And that doesn't mean necessarily better services. We do need to have better services in some cases, but the focus has to be on how do we affect better outcomes for Bob overall. So taking that whole system approach. That strategy has been in place since 2017, and that's the way we work across the system. So when you graduate, come back to Leeds. Just some examples of how some places, how digital is changing the system and take due regard to what skills might be required to think about this. So Centrion have developed a hospital at home solution for people with congestive heart failure. Biosensors now, people might be aware, biosensors only cost about 70p a go. Don't get me wrong, the kit you plug into costs a lot more than 70p. But nevertheless, there is the ability now, using some of these tools, that this tool can scan and monitor people at home to identify when their condition might be exacerbating so that they can take a more early intervention. But even in some cases, be able to report back to the patient itself, themselves, to say, just do this, take this action, and take the clinician out of it. So the key thing about this is that the only way this can work, it works through machine learning. It works through having extensive knowledge and information about congestive heart failure and what the results in terms of things like heart rate, blood pressure, whatever the results come in from the biosensors. But it also matches that with a longitudinal record of the person, because every person is individual and every person is separate. And so as a result of that, the machine learning can only be directed by specialist clinicians. So what skills are required in this type of world when we want out of hospital care or in-home hospital care? What are the skills required, which we've already heard about some of those, whereby clinicians with expertise in congestive heart failure, which I clearly haven't, what expertise is required in order to educate the machine to do the machine learning. But also in the lead system, that sort of technology and that sort of kit, although it's coming down in price significantly, it's still quite expensive, relatively expensive. In the lead system, one of the things that we are keen to do is manage this thing we call the left shift, and that is try to get to a situation whereby we can have earlier interventions at a community and locality level, that citizens are more educated about their health, about their well-being. And how can we also use, as opposed to the interprofessional networks that Trudy talked about, there may be other networks with community-based organisations, third sector organisations. There are thousands of third sector organisations in Leeds who are providing health and well-being type services to patients and citizens, which we would hope would prevent them coming into the system in the first instance, or if they're in the system, can provide a level of health and care. By way of example, I just use the example of my father from North Wales, where we haven't got some of this. So my father is ill and infirm, and unfortunately my mother, his carer, fell down the stairs, broke both her arms and cracked her head open, so therefore couldn't care for my dad. Came out of hospital, all sorted, but because he's been in a home, he's deteriorated. So he's at home, social worker comes out, we've got to get him into a care home. There are no spaces in the care homes. Don't worry about it. Get the GP out. No spaces in the care home. Oh, you're looking a bit ill there. Put my dad in an ambulance to Glenclude Hospital. He's then sitting outside Glenclude Hospital for 7 hours on the ambulance because there's no space. That's the sort of system we're in now. Whereas actually, is there an alternative system whereby potentially there could have been a community-based group or community-based assets that could have been employed in some way using digital platforms or technical platforms, whatever, to actually go and sit in with my mum and dad for periods of time, more than the 2 hours that you might get as a maximum through home care. So again, the skills are about, in my view, how do you start thinking about commissioning well-being type services or prescribing well-being type services? How do you start networking with the ecosystem of maybe third sector, community-based organisations and things like that to change that, start flipping the system? And we are attempting to underpin that with digital technologies in Leeds. So the 100% Digital Leeds programme is about how we're using up to now, there's 83 independent third sector organisations who are providing tablet lending and digital literacy training to get people within communities who've got health and care conditions connected with other people and in groups of people with particular conditions or whatever. And that's quite a successful thing. But it's thinking differently about, well, would you potentially look to prescribe a tablet or digital literacy training or information or whatever to try to address some of these type of issues. And the other thing that we're learning a lot about is that consumer-based technologies are growing at an exponential rate. So the amount of consumer-based technology that you could just buy off Amazon or potentially buy from Boots. So people might remember Richard Corbridge, who's my equivalent in the hospital. So Richard Corbridge, taking all the good learning from Leeds, and he's gone to work as a head of innovation at Boots the Chemist. And his role, I'm not familiar yet. Anyway, not bitter. But anyway, but just think about that if you think about your learning. But his role is about how do we develop the consumer-based technologies, or how do I bring consumer-based technologies from an ecosystem of innovators into Boots the Chemist to provide new services which prevent people going into health and care. And that is services that people will buy. People, I've got, as it happens, I've got cameras in my mum and dad's house. So if someone comes and presses the doorbell at my mum and dad's house, I'm not sure, down in North Wales, I can check who that is if my mum's not sure and say it's fine to let them in. So there's a lot of consumer-based tech which can start making a significant difference and starting to get into the medical space. And that is Poppy, who is using then I know there's some virtual reality stuff of sorts I couldn't see definitely out there, goggles to support with dementia, and that is making a significant difference to people's lives, and in particular making a significant difference to the carers' lives as well. So I think the point of this is to say this is the direction in Leeds. One of the things we recognise is that for the future of Leeds, we need to have digitally savvy leaders. And we're going to be looking at investing into a programme to help our existing cohort of clinicians, professionals, to get their heads around some of that and think about some of that. Because we believe that there is significant opportunity in changing the system for the good through using digital technology. But that's only if we have professionals with knowledge in those verticals with those digital skills. Thank you.
Thanks very much, Dylan. That was, again, really challenging us to think differently and think about how the future will unfold. Now, this next bit is tremendously exciting because this is our Vox Pox part of the afternoon. So this is the moment for those in the audience who very kindly volunteered for this bit. So this is about the opportunity we took to ask our medical students the questions that I've put up here. So I'm not going to read them out because they're kind of clear there. But I think I just want to thank the students who were prepared to do this. I suppose some may have seen it as a route into an alternative career. I guess I don't know, but I'm very grateful, as I know the rest of the organising team are, about the honesty that the medical students were about to hear came up with, and for those of us who are here to listen, I think it's really really enlightening to hear what our student colleagues have actually told us. So we're going to listen to these and watch them on there. Then just seeing how the time goes. After this, we'll have a kind of short break, but we'll probably move fairly quickly into the round table sessions so that we can get the most out of those informal discussions, which I'm sure again will give us lots of information. So here we go.